Hello and welcome to Economic Forum. My name is Tawanda Gudlanga. Zimbabwe joined the rest of the globe in commemorating Breast Cancer Awareness Month in October 2020. Now, this comes at a time where the world is being ravaged by the Covid-19 pandemic, and the big question is, to what extent are we looking at issues of cancer in Zimbabwe and the globe? And to give us that assessment, we have invited to the studio Dr. MUIA, who is from the United Nations Population Fund, UNFPA. Doctor, thank you so much for coming through.
Thank you so much for having me over.
Maybe as a departure point, tell us more about UN Population Fund.
United Nations Population Fund is an organization, one of the 23 UN organizations based in Zimbabwe, and we focus on the well-being of women from a sexual and reproductive health angle, looking at both good health and illness and looking at how to address it. We also address issues around young people. We also focus on gender-based violence, and overall we support government also. In all these, we are supporting government, but we also support government to collect data to inform policies, programs, and services that can be effective and efficient to change the lives of people in Zimbabwe.
Obviously, the month of October, you must have been the focal agency, really, looking, of course, at the fact that Zimbabwe joining the family of nations in looking at the Breast Cancer Awareness Month. Maybe tell us an assessment of this year's commemorations at the backdrop of the ravaging COVID-19.
Breast cancer is one of the cancers that is really taking lives, not just in Zimbabwe, it's a global one. And especially breast cancer, cervical cancer, which are cancers that affect women especially. However, in commemorating the month of breast cancer in October, one of our key pointers was that despite everything else happening in the world and in Zimbabwe especially, cancer is not going away. So we keep saying COVID is not going away. Cancer is not going away, and it is causing more illness and death than people know. So take, for example, cervical cancer. Within last year alone, we had over 2,000 cases. As for breast cancer, people think breast cancer affects only women. Yes, the majority affected are women, but we do get 2% of the breast cancer cases being men. They also have the risk because they also have the hormones. It is a hormonal-related kind of cancer. It is a very, very expensive disease to treat. And that is why within the month of October, one of the things we've been pushing for, despite COVID, is please do not neglect other disease conditions. Please go for checkups. And one thing I'd like to point out, picking up breast cancer early enough, the survival rate for more than 5 years is more than 90%. And if it's picked even earlier, it is almost 100% more than 10 years. And I know patients, women who have gone through, and men who have gone through breast cancer treatment and are alive more than 20 years down the line. And they land up dying from anything else, including road traffic accidents, but not cancer. And that's why, for me, it is preventable. And what are we doing to make sure that we focus more on prevention than treatment? Because the treatment involves surgery, it involves radiotherapy, it involves drug therapy. It's complex, and it's a long time. And it takes a toll, not just on the woman or the man affected, but the whole family. It takes a toll because people, when they hear you have got cancer, I hear some people referring to it as the big C. Everybody has fear of dying from it. And therefore, It affects the family, it affects the community, and it affects the nation as a whole. Once you're on treatment, it means taking time away from your routine work. So whether you're a woman in the rural area who goes to the garden, once you've had surgery, and the surgery, remember, is sometimes radical in that you remove both breast tissues and remove some lymph nodes under the armpits just to make sure that it does not spread. Can a woman go to the garden after she's had surgery, after she's gone through radiotherapy and lost half her hair? When they go through chemotherapy, they are exhausted. They lose blood, and therefore they become weak and can hardly focus. So what does that do? She can't do her daily chores in the house. So what does that mean? In the home, at the workplace, you take time off, whether officially or unofficially. What does that mean on the economy? You cannot contribute to the nation the way you would have. And that's why our biggest push is for prevention. And how do we do this? Simple. The best thing is get to your nearest health facility, whether it's a hospital or as a practitioner in your home area or in any health center. They are able to help you. And even as an individual, there are simple things a woman can do to herself. We teach women how to palpate their breasts, the different quadrants of the breast, and to feel if there are any abnormal lumps. We teach women how to squeeze the breast, because if you're not breastfeeding, if you have not been breastfeeding recently, and remember, cancer affects all ages. It's not of only a certain age. When you squeeze and you see an abnormal fluid coming out of the breast, so self-examination is the first pointer. And therefore, we need to engage communities more so that they know you can pick up early signs.
Doctor, we'll talk more after the break, but the big question is, why October being the month? I know we're having this conversation in November, and it is quite deliberate. Join us after the break as we seek to understand why this awareness that the doctor is giving us has always been focused on October and not throughout the year. Join us then. Welcome back to Economic Forum, where we are focusing on Breast Cancer Awareness Month, which took place in October. And we have invited in the studio Dr. MUIA, who is the country representative of the United Nations Population Fund, UNFPA. Now, before you went to the break, you were just giving us some of the pointers which our viewers can actually, do self-examination, going to the nearest health facility. But then one begins to wonder why so much emphasis is in October. Like I said, we're having this conversation in November, and some might actually think, oh, these guys are out of sync. But as Economic Forum, we feel that this is an important issue which should carry over beyond October.
Although October has been dedicated as the month, just like we dedicate in May Midwifery Day, we dedicate December 1 World AIDS Day. We do not stop talking about it. It is like to take a breather and stop and rethink and say, are we doing enough? And the month of October, we realized that it's a month that there aren't too many other disease kind of days hanging in there. And then COVID did not do us a favor because everybody was more aware and worried about COVID. However, we realized that it is important, not just we commemorate it in October, but it is every day is a commemoration day for breast cancer and other reproductive tract cancers that are eating into the lives of our women and men in this country.
But no doubt, Doctor, COVID-19 has reared its ugly head as we speak. Lockdowns are seemingly now the order of the day again. To what extent has COVID-19 affected the whole reproductive health narrative, which also seems to be quite ravaging as well?
COVID has really undone a lot of the gains we had made in many ways. Let me begin by a straightforward one. When COVID started, what happened? We had lockdown. What happened during lockdown? There was no public transport. You had to have a special letter to move around. So what happens to the women who had a lump in the breast? They wanted to go for care, but they could not move. They were not already on treatment. So it sort of slowed down. And the lockdown over the past 4-5 months has actually even slowed down health-seeking behavior of women, including for breast cancer. There were those who were already on treatment. The fear of exposing themselves to COVID made some of them stay back and not come in to seek treatment or to get their regular treatment. 2, remember the health sector was so overwhelmed. In Zimbabwe, we are struggling with the human resource for health. And then COVID arrives, and what happens? You're using the same human resource for health, but then they are also at risk of contracting the infection. Because it doesn't mean if you already had breast cancer, you cannot pick up the infection. But that service provider is not aware whether you have COVID or you don't. Yeah. What they needed was protective clothing. So it was two-sided. The women fearing and the men fearing to come in to seek care, because why am I going to a facility I might pick COVID? 2, the laws that were put in place were restrictive, and became a few obstacles, because without a letter, you can't move from Heathcliff to come to Parire Nyatwa to do your radiotherapy until you had that letter to show that you were going for radiotherapy. But to say I was just going to the hospital to be screened, everybody was prioritizing COVID. And it's like, no, stay at home. Let's wait a bit. You will go later. So there was a few obstacles, 1 from the patient themselves, 2 from the law enforcement for prevention, and 3, the service providers' fear. And as a UN, we've been trying to work together to see, 2, we worked with government, and yes, we were able, health-seeking behavior and people seeking health were a priority. And with or without a letter, as long as you said you were going to hospital, you passed the roadblocks. 2, the community got information that other services are still going on. It doesn't mean the hospital is only for COVID. And then they became aware that there are dedicated centers, even in the provinces, dealing with COVID. So that reduced the fear of them seeking for help. For the service providers, we've worked with other partners and with government, and I mean, it's been overwhelming, the amount of support that has come out for PPEs for service providers, because it was recognized that they are a critical force that need to be better prepared to manage. However, because of the fear, we don't know how many other patients we may have lost to complications of breast cancer, cervical cancer, other cancers, because of the fear of exposing themselves. So people feared to come out. And therefore, you can't blame anybody. I think it is human and it is perception. But as a UN agencies working in the health sector, we've been working through with our partners. And the other thing we have realized is to increase access for screening and treatment. Let us look at how we can better help the government to provide integrated services so that we have a one-stop shop for a woman, so that it's like a supermarket approach where you go in. If you have come in to bring a child for immunization, what happens? You get the opportunity also to be given information and services for other care, including breast cancer screening, cervical cancer screening. So we are working with government closely, not just at national level, but also at the decentralized level, to look at how best to integrate to maximize so that women have the opportunity and men also have the opportunity to seek care so that they can prevent this. But in doing this, one of the other important things is looking at what is the cost to people. We know the economy is a daunting matter, and it affects at the individual level, at the family level, and at the community and national level. And this is where we are trying to figure out which kind of services can be more subsidized by government. Just like immunization is heavily subsidized so that all children are immunized, why can't we also subsidize for screening for breast cancer and other cancers?
Join us in the third and final segment as we look at the way forward at a time where Zimbabwe and the rest of the world is battling against COVID-19, and there we are faced with the daunting task of also dealing with cancer. Join us there. Welcome back. We are focusing on the just ended Breast Cancer Awareness Month that was held in October, where Zimbabwe joined the family of nations in commemorating the impact of breast cancer to the country and, of course, the economy at large. And we have invited from the United Nations Population Fund, Dr. ESTHER MUIA, who is the country representative. Now, before you went to the break, you spoke of subsidies, and there has been talk around a cancer levy, sort of one that will sort of mirror or replicate the successful AIDS levy, which is still in place. From a UN perspective, is it the way to go, given the fact that cancer is the big C, as you put it across?
There are responsibilities and accountability by different parties. And no one party can carry this forward. And especially in a country like Zimbabwe, where the government is making an effort and doing its best to provide services, and partners come in to help. And I'd also like to take this opportunity to really recognize the efforts being put forward by a number of development partners. And I'm specifically speaking about development partners for health, who are supporting various programs that create awareness in the community. And therefore, it's looking at how can we best complement all these efforts. And I really appreciate the Health Development Fund. And we look forward to moving forward, and it's not just a development fund. We are now looking at it as a health resilience fund that can move forward. And as a UN, specifically UNFPA and UNICEF, we are working together with these development partners to see how we move into another phase where we build a resilient fund. Why do I say this? So that Zimbabwe, as it becomes middle income, is capable of independent existence, so that we run programs that we can demonstrate. So as we look forward to beyond 2021, this is from 2022 and forward, in line with the National Development Strategy, and looking at the SDGs set for 2030, working with these development partners, and even broadening the UN engagement in this Health Resilience Fund to look at how we can work with government to make sure that systems and structures are capacitated and strengthened to pick up both communicable, which is like COVID, and the non-communicable diseases like breast cancer. Through the Health Resilience Fund, we will work with other partners also to look at not duplicating efforts, but how can we strengthen. And I'd like to say the partnership is so critical because you bring in resources.
But Dr. MUIA, taking it from a people perspective, whilst from a policy development partner perspective, you're quite clear about how you can collaborate moving forward. But let's go to the local people. As the issue around cancer became talk, a lot of particularly indigenous people thought that cancer is for Caucasians. Have they embraced the fact that in fact it is affecting us as the indigents as well?
And that is why I said the commemoration, although it was in October, it's going forward. The idea of having a month of commemoration is to ensure that information gets out there. Did you notice what we did with COVID-19? It was everywhere. It was in the media. It was, everybody was talking about it in the homes, in the radios, in the TVs. There were posters everywhere. The supermarkets got their gun thermometers, and everybody talked about sanitizers. Who used to talk about sanitizers? I think we should learn a lesson from COVID and realize that we can create awareness amongst our people, and they can become responsible and accountable for their own health. You and I were sitting, social distancing became a norm. Why? Nobody came and forced us to do it. But the information that we were given, that as long as you're about 2 meters apart, then the likelihood of passing droplets to the other person. So why not get information out there? First of all, to say cancer is not a woman's disease, including breast cancer. It is everybody's disease, and it needs everybody to engage. And it needs everybody to have information of how do you get cancer. And that's why you will find now people know, don't wear tight bras, because tight bras do not help in blood circulation, and therefore you don't detox, as it were. So a lot of people then get to learn that when you get into the house, remove your bra and feel free.
Dr. Esther MUIA, so little time, so much to talk about. We hope you will be back again as we continue to understand reproductive health issues from the United Nations perspective. Thank you so much for coming through.
Thank you too. And I think the last message, my parting shot, is that take responsibility for your well-being.
So you had it for yourselves there. We've come to the end of this week's edition of Economic Forum. On behalf of the crew behind the scenes, my name is Tawanda Gudlanga, and it's pleasant viewing.